Welcome everyone. And thank you for joining today's webinar. I'm Kristefer Stojanovski and serve as the Research Director of Partners for Advancing Health Equity, a national research learning collaborative that's based at the Tulane School of Public Health and Tropical Medicine and funded by a grant from the Robert Johnson Foundation. And we want to start today by acknowledging the land that we're standing on in New Orleans is known as Balbancha, a Choctaw word meaning a place of other languages. And we honor generations past and present of the several tribes who live in this region. At Partners for Advancing Health Equity, our aim is to bring scholars, funders, community members, and the private sector to work together to better understand the latest issues related to attaining health equity. We do this in part by providing spaces for activities to engage with these groups in insightful conversations on timely topics and promote actionable solutions. And we're so excited to have you here today. And to help build a sense of community, I hope folks will enter into the chat. So for today's webinar, and in honor of Pride Month, we are focusing on discussing strategies to advance LGBTQ+ justice and health. We will explore LGBTQ+ health inequities and using our research and science to engage with policymakers to support the LGBTQ communities, which is particularly critical given this anti-LGBT movement springing up across the United States and globally. Which brings us to today's webinar, Advancing LGBTQ+ Health Equity and Policy. Today, we'll engage in a panel conversations with experts in the areas of LGBTQ+ health and policy, whom I'll introduce shortly. And before we get started, we wanted to post a poll to gain an understanding of where folks are coming from to the topic of LGBTQ+ health. So the history of sexual and gender diverse individuals has been filled with wide-ranging experiences of victimization and stigma. In 1886, one of the first books on the topics of sexuality was published by Richard Kraft Ebing, a sexologist of the time. And unfortunately, the quote unquote research he conducted defined LGBTQ+ persons as abnormal, criminal, and mentally ill. And while time has certainly moved on, many of the issues faced by LGBTQ+ persons are still the same as in 1886. And to showcase what those issues are, I provide this quote from a participant from Kraft Ebing's studies. "You have no idea what a constant struggle we all, particularly those of us who have the most mind and finest feelings, must endure, and how I suffer under the prevailing false ideas about us and our so-called immorality. Under all circumstances, the phenomenon is anomalous, but the word pathological conveys another meaning, which I cannot think suits this phenomenon. I will allow a priori that among homosexuals, a far higher proportion of cases of insanity or nervous exhaustion may be observed than in other normal men. Does this increased nervousness necessarily depend upon the character of homosexuality, or is it not, in the majority of cases, to be ascribed to the effects of the laws and the prejudices of society?" And despite being 136 years removed from the above quote, LGBTQ+ persons continue to experience a wide range of health disparities as compared to the general population, including, for example, as you'll see here, higher smoking rates, elevated HIV risk, which, as you'll see, have intersectional components with Black MSM experiencing the highest diagnoses, and poor mental health, which you'll see in a second, as you can see here in terms of gender identity and attempted suicides. And there's many other health conditions where disparities also exist. And these disparities are all too often driven by the social and legal disadvantages experienced by LGBTQ+ individuals. Homophobia and transphobia over the life course have a tremendous impact on perpetuating higher rates of poor health among LGBTQ+ globally. And despite the advances made over the last decade, there's been an erosion of LGBT rights globally. Here in the United States, 29 states have no protections against LGBTQ+ discrimination. This year, there are only 10 states in the United States that are not legislating anti-LGBT bills. And to date, there have been over 300 state-level anti-LGBT laws initiated in the United States. Given the rapid changes and backlash of LGBTQ plus rights and the health ramification, today's panel and conversation is more critical than ever. And so today we'll hear from our panelists who are engaged across academia, policy, and movement building. Welcome to this conversation, and I'm going to start by asking each of the panelists to introduce themselves and their work in LGBT health and policy engagement. And then we'll lead into a conversation with some questions and just open dialogue, which I hope you'll all engage with in the chat as well. So first up, we have Brad Sears, who's with the Williams Institute at UCLA. Hello, Brad.
Hi, thank you so much for having me here. I'm Brad Sears, founding executive director of the Williams Institute, which is a research center that does research on LGBT-related law and policy. Thank you.
Thank you, Brad. Next up, we have Toni Newman with the Black AIDS Institute.
Good morning or good afternoon, everyone. I'm Toni Newman with the Black AIDS Institute. I'm a trans woman of color who's been in this health equity fight for 15 years, and I'm just so glad to be here. Just a little information, the Black AIDS Institute is a national think tank trying to end the HIV virus in the Black and Brown community. Thank you so much.
Thank you, Toni. And lastly, Anneliese Singh, who's at Tulane University. Hello, Anneliese.
Hey, Kristefer. Hey, community. Thank you for hanging out with us today. I have to say I'm pinching myself to be in a webinar with Toni and Brad. What an honor. Happy Stonewall Pride Month, everyone. My name is Anneliese Singh. I use she and they pronouns and serve as Chief Diversity Officer at Tulane University, and I'm a researcher. I've researched trans and non-binary resilience as resistance and trans liberation for a hot minute. And I use she and they pronouns and identify as a non-binary mixed race South Asian person. Look forward to the conversation.
Thank you all. Wonderful. So I can't wait to start this conversation. And first, I want to give a question to Brad. And so we know that homophobia and racism are the root causes of LGBTQ plus inequities in health. So what keeps you and the Williams Institute up at night as you all engage in this work? And also, I would love to pose the same question to those in attendance. Please use the chat as you respond to that question as well.
Yeah, Kristefer, I mean, it's a great question, and it's different things at different times. But, you know, I think really what's front and center right now is that over 300 pieces of anti-LGBTQ related legislation, this kind of just overwhelming assault of anti-LGBT legislation in 2022. That when I helped start the Williams Institute 22 years ago, I would not have thought we would be fighting not only some of the same fights as we were 2 decades ago, even some of the fights I thought even at that time we might have resolved. And I think it's a good reminder that the law is a determinant of health. So is this discussion and policy discussions about the law. And so if you're an LGBT person or a youth living in one of these states where there's daily news about a debate about your right, which is largely motivated about misinformation about who you are, negative information, who you are, we also know some research that has a profound impact on health as well. And so, we're in this odd moment where, the president issued this sweeping executive order last week, much of it focused on health of the LGBTQ community in general, but in youth in particular, and then this kind of onslaught at the state level. And that onslaught is really directed at youth, whether it's bans on gender affirming care, students participating fully in school activities like athletics, parents being threatened with prosecution for supporting their children. It's really an attack on youth and families. And so I think all of us have a lot of motivation to keep going with this work and to make sure that we continue to gain ground and not to lose it.
Yeah, thank you, Brad. And I'm so struck by the words you also used, overwhelming, and that, what a powerful word in terms of what that actually means, the inability to function because we're so just inundated and overwhelmed, can't handle what's happening. And how do we create space to also practice liberation and joy and happiness in this moment is something I'm also pondering. And I want to ask another question, with a lot of the work you all do in policy translation, how do you see our research really working to combat this legislation that we're seeing unfold across the country?
Yeah, well, that's the whole mission of the Institute is founded on the research matters, that doing kind of rigorous research that tells the truth about LGBTQ people will make a difference wherever that research leads. And I think, we've had 20 years of experience plus showing that to be true. And so showing the reality of what happens when you provide gender affirming care and both the physical and mental health consequences if you don't. Showing the positive benefits to all kids for participating in sports, which for most kids are after school activities and in group sports, not really about, rarely about the elite athletics that's so often mentioned in the news, the positive impact of that, but then the negative impact on trans, non-binary youth, and I think on girls and women in general of this current discussion about sports and girls and women's and trans people in sports. I think the negative impact goes beyond just trans and gender non-binary people. I think what's true is a lot of things get asserted about who LGBTQ people are. And those assertions can often be proven or disproven with empirical research, and that's why it's so important. I think the work that we all do, and not only doing that research, but really making sure we link it up to those policy discussions, and that policymakers have access to it. And I think that ends up making a profound difference in people's lives. I know I just mentioned a couple of examples in my experience where kind of the research changes policy and you can start to see an impact in health. If you look at marriage equality, for example, so long that discussion was about, how do the children of LGBT parents come out? Are they any different? And it took, really scores of studies to finally lay to rest the assertions that were negative outcomes for the children of same-sex couples or LGBT parents. And that led to the Supreme Court, extending marriage equality to all 50 states. And what that meant is if you're somebody of my generation, is something you thought would never happen in your lifetime, suddenly did happen. The impossible became possible. For people in younger generations, something that LGBT people could not think about, plan of, hope for, develop, suddenly came into the realm of possibility. And just the mental health impact of that one aspect of marriage equality alone, combined with all the tangible benefits that we know come, I think are some of the incredible benefits that come from research that leads to policy change.
Thank you for that powerful example. And, I love the way you framed it, research that tells the truth. And how do we use our research in that way? Thank you, Brad. Toni, I have some questions. I'm curious about the work you all are doing at Black AIDS Institute, and also particularly, how are you framing the discussion and work of LGBT health in Black and Brown communities that you work with?
We're here at the Black AIDS Institute. We are focusing now on Black and Brown women of color and trans women of color. We see these are the two main populations that the numbers are excelling. They're the high numbers. So we're taking conversations and collaborating with Black women's groups, Latin women groups, Asian women groups, trans-led organizations in order to really have a conversation about PrEP, about HIV, about health equity. What are you finding? I am currently a part of a research project now, and as Brad says, data is so very important because ignorance is bliss, and data gives us the truth the authentic truth of what's happening. So that's what we're really doing at the Black AIDS Institute, are focusing on the groups that really have the high numbers in HIV. And we're finding that transgender women of color are 49 times more likely to be living with HIV when compared with the general population. And that was a study done by the National Coalition of STD Directors in 2021. They did a data analysis among trans women, specifically of trans women of color. And that's where we're seeing the most in health inequities are among women of color. They seem to be one of the most ignored groups, and trans women of color. So BAI is focusing on that. That's where we're putting our bread and butter, as we say. And that's what we're trying to do to balance the inequities in the Black and Brown community. Because to be honest, I mean, transgenders make up 1% of the population. Even though there are several laws attacking transgender folks. It's always amazed me how people focus on a population that is like 1% of the United States population with inequities, with transphobia, with homophobia. It just amazes me of why you're focusing on a population that small that I'm a part of. I just never get it. And I transitioned 25 years ago. What's happening now was happening 25 years ago. There was no Pose, there was no TV shows, there was no stars. I didn't know anybody who was transgender getting out of Wake Forest, getting my MBA. I thought I was the only one. And now we have all of this presence. And now we're being hit by laws to prevent us from being our authentic self. So that to me is an inequity of not allowing someone to be their authentic self, whether that's health, education, medical practices. That to me is a health inequity. So yeah.
Thank you, Toni. No, absolutely. You know, just the ability to be and who we offer the ability to be to in this country is something that I have been sitting with over these last few years, and especially in the work in this space. And thank you for just, you know, sharing that in terms of the ability just to be authentic, just to be who you are.
I've done this to myself. This is my body. So this was a transition done internally, externally for myself. You may not like it. You may disapprove of it, but it did no harm to anyone else. I'm the one suffered the pain, the surgeries, and all of the other things. I should be the one with something to say. I've never really understood why people were so concerned about what others are doing to their own bodies for their own authentic self. That's always baffled me.
Yeah, thank you, Toni. And I want to also, you know, in the same vein as the one with Brad, what do you see as the need for us to strengthen the role of research in policymaking related to LGBT health? What do we should be thinking about? How do we make this more impactful?
Well, we need research. I mean, because basically at this point, there's a lack of knowledge, there's social stigma, there's ignorance and discrimination among the transgender and the LGBTQ community that are often ignored and underserved by healthcare providers. So my thinking is that we need some medically trained, competent physicians, people who are aware of I'm transitioning, I'm on hormones, I'm also could be HIV positive, and I also need care. That takes training in my mind, and that's where the research I think is very vital. That's why I'm a part of several research projects, and I'm always eager to sign up because knowledge in my book is power. When we know better, Maya Angelou said we should do better, and knowledge gives us that right to do that. So I think research is very important. I'm a part of several research projects, leading one and a part of two others to give data on what health inequities look like in the LGBTQ, but of course my expertise lie in the T, since I've been a trans woman of color for over 30 years. That's where my passion lies, and that's where I focus my inequities on, the trans community, because that's the community I've been a part of for over 30 years. So.
Thank you, Toni, for sharing that. I love that. When we know better, we should do better. Absolutely, absolutely. Anneliese, I have a couple for you, and then, you know, please, as this is all unfolding. Please jump in, Brad, Toni. These questions are definitely for all of us here. So Anneliese, you and your team are engaged in some interesting research looking at identity formation, resilience, and risk with trans identifying communities across the US. Can you just tell us more about your work, how you came to that focus, why that focus, and why it's so important to the field?
Yeah, sure. And I just loved listening to Brad and Toni. I mean, I think for me, I've been kind of a scholar activist for, I guess, since mid 2000s, and, was able to start a recent longitudinal study with trans and non-binary folks called Project Affirm with Walter Bakhtin and Alan LeBlanc. It's a longitudinal research, and we launched in 2014, and we've been looking at resilience, not your white, Western defined, like, oh, it's hard to get out of bed and I'm having a bad morning, it's humid outside, but like, how are people resilient to multiple levels of discrimination as resistance? We've also looked at risk and identity development, but I will say that, one of the cool things about the project is we made sure that the majority of our sample were BIPOC, Black, Indigenous, people of color, and a third were non-binary. But you can imagine the heartbreak we found along the way as we followed people since 2015. Our youngest is 16, our oldest is 89 years old. But when you get to above 50, you don't see 50% of that cohort as being BIPOC anymore. We've seen, and we know that's because of the intersection of systemic racism and trans prejudice that escalates death and literally steals lives from our trans and non-binary siblings, especially who are BIPOC. And we've also seen in this sample that gender misgendering, gender microaggressions, macroaggressions, those things are no joke. So for those of you who don't want to put your pronouns on your Zoom, get over yourself. People you can put your pronouns on your Zoom and underneath your email signature. Maybe while we're here together in this webinar, there's something about the environment, and our longitudinal cohort is really paying attention to how safe and how affirming environments will be for them. But I think one of the most important things we've done in this study is, we've had a lot of theory about trans and non-binary folks. Unfortunately, not most of it was driven by trans and non-binary people themselves. So we asked them, we used an innovative Lifeline protocol that we literally said, hey, from birth to death, how is this going to work out for you with your identity development? And when we look at the cohort as a whole, what they've talked about is, as they come to clue into their gender identity, right? There is some confusion and chaos, not because of what's inside them. Toni was kind of talking about that. It's not a conflict within themselves. It's a conflict between what they're feeling in the environment, society. And then there's almost this, literally, we called it beginning of life, because that's what some of the participants called it, like people finding themselves by finding others online, and then moving out and about into the world, really experiencing trans and non-binary liberation and validation. Often that was facilitated by moving, which means, especially for our BIPOC participants, they might be moving out of or away from communities of color, then feeling accepted and loved, right? I mean, I want to keep building towards a world where trans and non-binary folks don't just feel safe, but we feel loved deeply, and that society builds institutions from that love ethic. And interestingly enough, as trans and non-binary folks kind of talked about their own identity development for themselves, kind of the later space, I would say, not stage, they talked about giving back and really reflecting on the meaning of their lives. So there's a lot more I could share about that study, but I think, we've been able to dig into the Black and Latinx participants and look at their identity development too, and see the important role of spirituality and ties to community, and then just deliberately having a future orientation when society is telling you something very different.
And if I may say one thing, if when you're talking about TGNC and trans health, how can you talk about that without having representation of those people in the conversation? And I always say this, of all the people on the line, if you're a healthcare provider, how many TGNC folks do you have in your management, leadership, and on your staff?
Yes.
You don't need an MBA to be an HIV tester. I started 25 years ago testing in a van with no heat. You don't need to have a doctorate degree to be a coordinator of HIV services. If you want to reach this community, this TGNC community, you need to have them represented in your healthcare facility. That means if you're serving Black folk, you should have Black. If you're serving Spanish speaking immigrants, you should have them going out in that community. They look like them, they speak the language, they're way more acceptable than a white and or a Black going to Latinx. So I ask everyone who's here, if you're a healthcare provider, please look into hiring trans TGNC individuals in your companies, in leadership, in representation, because representation matters.
Thank you, Toni. And I would just add, and pay them what they're worth, which is not what they tend to be paid. So,
amen to that. Look up the Northern or Southern California Nonprofit Pay Guide, or wherever your state is. You can get it off of GuideStar. It'll tell you what a person with 2 years experience and a high school diploma should get. So I agree with that 100%. Pay equity is also very valuable.
Thank you for that, Toni. Brad, is there anything that you wanted to jump in on there? I saw your camera come on.
Yeah, no, I echo all of that. It's just extremely important. It's extremely important to have people who are, nothing about us without us. So having people who are directly implicated in the research be part of the research, and what I find time and time again, even in our own projects, when we don't have that, we miss things. We are about to put out a report about employment discrimination experiences, focus on bisexual men and women. And it's, and we've been doing reports on employment experiences forever, and sometimes we'll break out the B, but we usually won't say much about it. And this is the first time we did a deeper dive, and it revealed kind of much higher levels of not being out by bisexual men and women in the workplace, but particularly bisexual men, a lot more covering behaviors. I think a lot more kind of anxiety about presentation in the workplace, whether it's appearance, voice, mannerism, and then different patterns of discrimination, particularly harassment. Some which we're very familiar with, like bisexual women being subject to sexual harassment in the workplace, but others that were kind of more surprising, with high levels of verbal harassment and physical harassment of bisexual men. But it's, I think if earlier on we had some people on the team who could have brought that experience to the research, it wouldn't have taken us several years to really highlight those findings, which are really important for the people who are experiencing that, and if workplaces are going to respond to the diversity of LGBTQ people in their workplaces.
Thank you, Brad. And I appreciate you mentioning we'll call it a little bit of like accountability piece there, where it's like, had we had bisexual persons on our team, we may have maybe answered these questions quicker and faster and differently. Thank you for just saying that, how much, that representation is critical to the way we do our science, the way we do our research, and then how we use it. Thank you for that. And Anneliese, so many nuggets from yours. When you were talking about the cohort moving over time, when you get over 50 plus, how a lot of the Black and Brown, Indigenous persons of colors, the numbers drop drastically, and stealing lives, how our environment is stealing lives, intentionally killing Black and Brown individuals, Indigenous and trans, and like how really this is just living is a conflict for LGBTQ identifying individuals, and how the health ramifications arises from that conflict with the environment. And so I so appreciate that. And I'm curious to learn more about this Lifeline Protocol. Actually, I would love to hear more about how you're using it and how it's informed your work.
Yeah, just briefly, I think it was something that, we adopted from DeVries and colleagues. And, I think that the really unique thing about it is, and we shouldn't have to say this, we put the power in the hands of trans and non-binary folks. We actually didn't, right? We actually looked at them as actually having the power. We didn't have to give it to them, right? But they really created their own timeline of their lives. And you can imagine for our youngest participants, they were imagining what their life would be like, right? For our oldest participants, they're looking back at their life and reflecting on it, but also looking forward to the remaining life to see what they would expect. So I think those kind of spaces that they identified were huge, confusion and chaos, beginning of life, moving out and about in the world, feeling accepted and loved. Where they were experiencing that acceptance and love tended to be because of that geographical move. And then as they got settled, they were really, how powerful is that? Like giving back. I don't know, maybe if we did a study of cisgender folks, maybe we'd find something similar about identity development for them, but I doubt it. But I think that just points to the mutual aid that is just so prevalent in trans and non-binary communities just to get through, which is why I still study resilience as resistance. We've got to study liberation and always have our eyes on liberation is the goal, and it has to be Black liberation. I think we know that because when Black, trans, and non-binary folks experience liberation in this world, that means we will have all experienced it. But I think until we are at that liberatory point, I think we still need to study resilience as resistance and how people are navigating these systems, and then start to study the systems themselves, right? We kind of know, and again, Toni talked about, some of the folks who've done this work for years in the community, who've kind of known how to relate to, whether it's BIPOC communities or other trans and non-binary BIPOC communities, but we've got to be able to create more systems where there are more pathways for folks to be able to gain access to all these institutions. And I think that's where we really need to see the research pivot to in queer and trans health.
Thank you for that. Absolutely. The systems, as a system scientist myself, so that was particularly an area of work that I'm very curious about. How, when we're talking about this conversation that we're having, I still think back to that 1886 quote, which is just wild to me that we are still in the same space where we're like still thinking about the same things. And so how do we move to that systems oriented thinking, right? We recognize it's the laws, it's the prejudice, it's the stigma that is creating these health inequities. So, but how do we understand, how do we flip those systems? How do we allow them to produce health instead of health inequities? What does that look like? What is our system full of love look like? How do we create it? These are absolutely questions that I love and sitting with. I hope you all are getting inspiration from this too here. And I see a question in there. BIPOC. Oh,
Thanks, I'm happy to talk about that. It kind of goes back to the question you asked Brad about what keeps you up at night. I use that phrase BIPOC for a reason, because it, when we talk about people of color, it kind of just melts everyone together. And especially in queer and trans health, we know what happens to our Black, Latinx, and Indigenous siblings, right? So it's not that our API siblings and our mixed race siblings are left out, but I feel like BIPOC really reminds us we have to do the work on anti-Black racism. We have to do the work on Indigenous colonization that really kind of formed this country, right? And gave us this gender binary and this sexual orientation binary that it wasn't ours. Some of my heritage is from India, and I can tell you, like, the binary was not our heritage. Colonization and British colonization gave it to us, and that's when you saw queer and trans communities decimated by these laws. So honestly, I'm not surprised by these freaking laws. They're very predictable in terms of furthering white supremacy, and these gender binaries and sexual orientation binaries are a key part of or pillars of holding up anti-Black racism and Indigenous erasure. So the thing that keeps me up at night are the levels and layers of healing and repair we need to do, and the executive orders and laws we need to see about cash money paybacks. And that I would love to see these bodies of research start meeting each other in a more deep and intentional way. Because we know the story in queer and trans health. It's been the same story for a while. What's going on with our BIPOC siblings?
Brad, did you want to add to that?
Yeah, I actually just saw the other question in there about kind of using, which is related kind of like, what are the questions that we use? How do we even allow people to identify themselves in this research when these concepts are so, they vary. This isn't kind of one size fits all or one answer fits all, and they're evolving over time. I'm going to put in, if folks don't know about it, the recent National Academies report. One of our researchers, Bianca Wilson, who's done a lot of research on LGBTQ kind of communities of color as well as youth, was one of the authors of it. But if you haven't looked at that, it has a set of recommendations. But one of the main recommendations is that context matters, and so kind of what community you're working with on your research, the purpose kind of for the research, all of that matters. If you look in the introduction of the report, it tends to not favor using the term other, but having options. I identify as something else, and then letting people fill in what they identify, which is great. I also would remind people, if you ask people to do that, you should sure you have time also to analyze all those responses, because that's a different time commitment than analyzing, as you know, the other type of data that you're getting. So I think you should, also make sure that you have time to do that. There is, if you click through, you can get a PDF for free on there. I think you have to give them your email at some point. Yeah, that's it. But you can get it. And I just, I guess just kind of one quick story. We were involved with the Blue Diamond Society, which is the largest group in Nepal working with LGBTQ people, and working with them to develop questions for their national census. But in Nepal, there are, 20 plus different commonly used terms that really don't map onto LGBTQ. Some of them have, deal with different historical terms or specific communities that combine kind of what we might think of sexual orientation, gender identity, and identification of being a dancer, like might all be combined into one term. And so it was interesting doing that research, very much kind of us supporting the Blue Diamond Society, talking to people to figure out what set of terms kind of would fit into the census. And most people would still feel positively about identifying with those terms. And we were able to kind of do it, I think, in 6 terms or less. And people saw that as a primary term, but it was a kind of a couple of year intensive process to work through that. So I would encourage you to follow recommendations like the NASEM report, but also just consider the community you're working with and context.
Yeah, thank you, Brad. And for the global conversation too. This isn't just a US based issue. I do work also in East Africa, Southeastern Europe, and these exact questions that you're asking about, what terms are we using? Whose terms are we using? Was a big part of the research in terms of how we're talking about it. And, there is this, folks don't want to use some of these terms that we use, lesbian, gay. It's very Western. It's very not part of the community. And so how do we create research that spans globally? How do we understand each other, even when we're starting to use different terminologies that are related? So thank you for that, uplifting that conversation as well. And Toni, Brad, and Anneliese, this is for all of you. I've been hearing a thread of intersectionality coming through all of the way we're talking about this. So how are you all thinking about that in your work? How are you letting intersectionality inform how you're doing the work, especially around research and also engaging in policy?
I think you just have to put race front and center in the work. I mean, in Georgia, when I was there back in 2009, we started the Georgia Safe Schools Coalition. And as we were working with, again, a lot of white, well-meaning, gay, cis men who joined the coalition. They were like, if this was racism in the schools, this would never happen. And we were like, we live in Georgia. Like racism is deep as like the word we now use, Georgia, right? From the colonization of the land to all the anti-Black racism that happened on that land. So I think, it's got to be from the start, and so in the Georgia Safe Schools Coalition, what we did is really had that conversation. It wasn't like, oh, we're tacking race on, but it was the vehicle, right? Because we know it's how we got to this place. And so that really allowed us to have conversations. We used more of almost like I would maybe call it a peer-to-peer model. Like we would match school counselors with school counselors, teachers with teachers, administrators with administrators, young folks, students with students, and have these conversations. And, I think with intersectionality, I think one thing we haven't done well across all the disciplines in queer and trans health is really to cite Black women, from Sojourner Truth to Professor Kimberly Crenshaw to Dr. Lisa Boleg. These are the folks who really defined and uplifted intersectionality theory. And so I think, citing correctly, citing well, and then having it be the starting point. That's the only way. We know what racism does to this world and to people and how much life it shortens. So in queer and trans health, we've got to look at that from the beginning.
I agree totally. We are centering race in our work. It is first and foremost. And as Anneliese said, it is the vehicle that's driving the train. It is the engine that is propelling it. Once we deal with the race issue, which I think is at the very core of the matter, I think there can be movement of positivity once we deal with that core of discrimination, phobias, transphobia, homophobia. I agree with her completely on her statement.
Yeah, and I'll add in a couple of thoughts. I think the first is to really make sure, if you're making comparisons between LGBTQ and non-LGBTQ people, that you're very explicit about that you're already talking about very different communities in terms of, first of all, in terms of sex and gender overall. You're talking, most LGBT people identify as women, that it is a more racially diverse group and it is a younger group. And so I think keeping that front in mind whenever you see those comparisons, and then really being accountable. And I really have to watch our own work sometimes. It's nice to get like a nice headline, like LGBT people are 2 times more likely to be living in poverty than non-LGBT people. Well, if that's really a statistic about trans people or bisexual women with kids, and when you actually like parse it out, which often does happen, that gay men most frequently, or gay and bisexual men, aren't the ones facing the disparities either on the health indicator or on a socioeconomic indicator. I think being really clear about that, and I think it does. Again, it's like we're telling them the truth about our lives. So being very specific. I think with and some of it we just have so much more data and it's such higher quality. We can be that specific now where we couldn't be in the past. That's really important. And then I think the final thing is just, I think recognizing that when the right is attacking critical race theory and abortion and LGBTQ rights and passing, don't say gay laws, like they're engaged, they see that as a unified piece of work. They don't see that as separate things they're working on. And as a matter of fact, it's the same people, it's the same funders, it's the same places generating those bills at the state level. And so I think it's important that we also don't do research or craft research questions that are only responsive to a fraction of what's actually going on there. So if it's actually about just supporting kind of white supremacy through taking over our democracy, that we are aware of that in our research. If it's about privatizing public education and all of these issues, I think often hit on public education and youth as a way to make public education sound so problematic that we have to do something, or that people should do something else, that we also frame our research kind of with that in mind. And be kind of fearless where that takes us. I've been doing research on HIV criminalization for, depending on how you count, for decades, but kind of more seriously for the last like 8 years. And that started with a misunderstanding that these laws were impacting kind of men who have sex with men primarily. It's not at all the case. The best understanding of how, whatever you think of the intent of these laws, the intent of their enforcement today is a tool in a criminal system that goes after Black people to have easy to prove, high consequence crimes to add on to the over policing of Black people in general. I mean, and you can look on our website. We've done about 12 deep dives in different states on this. That is the way to understand those laws. And sexual orientation is still a lens to understand the laws. It is definitely not the primary lens about what's happening with enforcement today. And so I think it means kind of being very open and fearless when we're thinking about intersectionality and where that leads us.
Yeah, thank you, Brad, Toni, and Anneliese. I want to uplift a question in here from Elise, and then we're going to move into closing this out today. Thank you, everyone, for being here and sticking with us. So Anneliese, Elise goes back to said how much data matters, and how do we kind of work through or address the well-earned mistrust and fatigue that LGBTQ communities might be experiencing with what we're doing as researchers and academics in the whole field. It's a big one, isn't it?
Yeah, I mean, we know trans and non-binary folks are one of the most understudied and underserved groups. And I go back to that 1% thing that Toni was talking about, and it seems unimaginable. But then when you think about the context of anti-Black racism and colonization, how this country was set up, it makes so much sense, so there's going to be fatigue there over and over and over again. The laws, I mean, we've seen this since abolition, right? 400 years ago. I mean, you see, post-Reconstruction, you see advances, and then right after, you have the white backlash, and then you see Jim Crow and mass incarceration. I mean, it's like a playbook that's been played in the land we now call the United States of America for a while now. And so I think it brings me back to studying the systems. I mean, what's working? How do we support more of that? There is a ally, co-conspirator, accomplice identity development. When people switch over, there's a journey that leaders have made, that when people decide to not just, we got to do this work a little bit, and I think studying those systems, thank you, Kristefer, for doing that work, but you probably know, are we studying the right systems? Are we studying what systems are doing well that's like promoting health and liberation? I don't think we have a very clear definition of liberation. I started in 2020, I finally, just based on scholars like Bell Hooks and Gloria Anzaldúa, I took a try at just defining it, but I think if we don't have a good, real solid definition of queer and trans liberation, it's hard to know where we're aiming for. And are we really just aiming for queer and trans liberation? I hope not. I think that it has to be the compass of Black and Indigenous liberation, and we'll all get there. It would just have to be that way.
And I would also advocate for having researchers of color on these teams from these backgrounds, who know these individuals and are able to really move the process along from personal knowledge as well as professional knowledge. I think it's very helpful to have. I love research, but I think research is very vital when it comes from people who are involved in that community, people who understand that community, and who's probably lived in that community. They can give the best insights.
Thank you, Toni.
Yeah, and I think it's a great question. I've had an example from this week and this year where I have other folks at UCLA behaving badly. And one is like somebody wants to debate on like, a debate on kind of trans people's access to kind of sports and athletics, and it's coming from a kind of sensationalist negative place. And the other, there was a group of researchers on campus who were doing some research. I don't even, it's like some more kind of biomedical research they wanted to do on trans people. And they claimed to have engaged a lot of trans organizations in LA in that work, which was absolutely not true. And people were getting these surveys and getting this request to participate that were pretty offensive. And I feel fatigued at having to respond to that all the time. But I know if I don't, that my work will also be hurt. That if in LA, if people at UCLA are doing stop, that actually impacts all of us. And so, it's just been kind of a good reminder to me that, we all have to kind of be accountable and be kind of very considered in our own work. But if we're part of bigger institutions, we also have to make sure our colleagues are doing the same, even if that can get tiring at times.
Yes. Thank you all for this. And I see all the chat coming up in here, and Anneliese, thanks for sharing resources. Yes, we are definitely coming up on time, but Paige, I will touch base really quickly on kind of bargaining chip unionization. And maybe if it's helpful to you, the University of Michigan, actually, the graduate employee organization has been really successful in securing and safeguarding trans healthcare within their bargaining agreements. And let me tell you, it has been a long time coming to get that worked through with the university. But these, when I think about the question you ask, how powerful capitalism itself is on driving these inequities themselves and using something like basic healthcare. But yes, I see this yes to a part 2, and I'm happy to put that on with you all. Absolutely. I see the thumbs up too. So everyone, I just want to say thank you so much for being here with us, sharing your thoughts and wisdom. Toni, Brad, Anneliese, everyone through the chat. Thank you for offering your insights. We hope you found this time productive, and we would love to hear from you all. We're going to put a survey in the chat. So please, fill it out. We'd love to hear what worked well, what didn't work well, what else we should do. I'm already hearing a part 2. We can definitely make that happen. I love talking about this type of work. This is the space I live in. I love being surrounded with all of you all. This great discussion and just the inspiration. Thank you so much. And please continue to follow us. And join the conversation. So on July 19th, 2022, we'll have our next one on communication and media engagement on health equity research, how to use those levers as well. And so that's wrapping us up. Please follow us on Facebook, Twitter, all of those. And please, also join as a member. This is the best way to stay in touch with us, for us to get resources to you all and help you all on the journey to health equity and liberation for everyone. So thank you all.